Thank you, Eric. So the Republican leadership says Medicaid is welfare. And, quote, young men need to be out working instead of playing video games. But guess what? Medicaid isn't welfare, it's health care. And people like Medicaid. Almost 2/3 of Republicans and the vast majority of Americans say Medicaid is a good thing. And here in New Jersey, it's 1 in 5 receive health care from Medicaid. That's 1.4 million people. 500,000 of those 1.4 million are children, and 300,000 are either elderly or disabled or both. And more than half of what we spend on Medicaid in New Jersey is on older adults or people with disabilities, not young men playing video games. So should those children, those older adults, those people with disabilities be out working instead of playing video games? The CBO estimates that 410,000 people in New Jersey would lose their health care if the big ugly bill is enacted as written. And guess what? 71% of the people who receive Medicaid already work. Many who aren't working are home taking care of their children, their older parents, their disabled relatives, or are disabled themselves. And work requirements have been tried before. Arkansas did it in 2018. In only a couple of months, 18,000 people lost their health care. My own Congressman, Tom Kean Jr., AKA Nepo Baby, responded to my email urging him to oppose the drastic Medicaid cuts, saying that he voted for the cuts because the program was, quote, riddled with fraud, waste, and abuse. This isn't true. As the late Senator Daniel Patrick Moynihan famously said, you're entitled to your own opinion. You're not entitled to your own facts. Last year, the Medicaid improper payment rate was 5%, down from 8.6% in 2023. And almost 80% of those improper payments were due to paperwork errors. Making a mistake on a form isn't fraud. It's just a mistake. Fraud, waste, and abuse is their dog whistle to take as an excuse to take away people's money to give back to rich people. Half of all adults in the United States say it's hard to pay for health care. We heard that story from our organizer. 1 in 4 say they or someone in their household has delayed getting care because they can't pay for it. They might have to decide between health care or food, or health care or rent. People with medical debt often delay getting care because they can't pay for it. And when they do finally go get care, they're sicker. And the care is often uncompensated, which means it costs more for all of us. So think about it. Would you rather have your cancer diagnosed at stage 1 or stage 4? Surprise. People with Medicaid are the least likely to have medical debt, which means they get the care they need, which means they come to the doctor when they need it, not when it's too late, which means lower costs for all of us. It's way cheaper to treat somebody's high blood pressure than to treat their heart attack or stroke. I have 2 stories, one from a friend shared with his permission, one from my own practice. All names have been changed. My friend and fellow congregant Bill and his wife are both 80. They have a severely autistic son who's 50. He receives Medicaid. Bill has told me if his son loses Medicaid, they will have to sell their house. And their son, who's been doing well in community housing, would either have to be institutionalized or, as Bill said, my wife and I would have to figure out how to care for him at 80. Doesn't Bill's son deserve quality health care? For almost 25 years, I saw patients as a volunteer faculty member at Rutgers Robert Wood Johnson. My longtime patient Amanda had severe lupus, complicated by bone and lung disease. She had a wonderful 4-year-old son for whom she was the sole caregiver. She wasn't lazy, staying home playing video games. She was a chronically ill woman caring for a child. Sadly, she's no longer with us, but our friends and neighbors are still here, and they deserve health care, not insults. So don't be fooled. These cuts to Medicaid are just a massive wealth transfer from people who rely on Medicaid for their health care to the uber wealthy. Helen Keller, who, by the way, was a co-founder of the ACLU, said, alone we can do so little. Time out. Alone we can do so little. Together we can do so much. So call your senators and representatives and tell them we are not fooled. Thank you.